Today I would like to discuss what is tummy tuck and who needs a tummy tuck. My name is Dr. Nimal Gamage. I'm a cosmetic surgeon, American qualified, currently practicing in Colombo, Sri Lanka. And tummy tuck is also called an abdominoplasty, and this is a term used where we remove the excess skin from the abdomen and stitch it back so the stomach looks flatter. And usually this is required for people who have a lot of loose skin. Sometimes the skin can be so loose that skin can hang like an apron, like in this picture here. And in some cases it may not be so loose, but still, because the looseness of the general abdominal skin, we do remove that part of the abdominal skin to make it tighter. The requirement for a tummy tuck is that the patient, especially a woman, must have completed all of her pregnancies, because once you do a complete tummy tuck, the skin is so tight it will be difficult for her to conceive and have a normal pregnancy. And also we would like to see the patient at her ideal weight for her height. So if the patient is not at the ideal weight, what we normally recommend is to go through a liposuction, remove the fat, and then go through a diet program and lose some weight, because when you do a liposuction your skin contracts and then we don't have to remove so much skin for the patient at the end. And also the ideal patient for a tummy tuck is a person who has a lot of loose skin in the abdomen, such as what we have shown in these two pictures. Now we have a new technique for tummy tuck, and I will discuss the difference between the old and the new technique and why the new technique is so much more advanced. We call this a liposuction abdominoplasty, and usually the liposuction is done with tumescent anesthesia, not with the old technique under general anesthesia. They are done under local anesthesia, and once you do the tumescent solution, the fat swells up, such as seen in this picture, and your skin is going usually numb at the end of this liposuction procedure, so it's easy to remove that skin. And this is before and after picture of a liposuction. But anyway, once you have done the liposuction, then we can remove the skin, usually beneath the belly button. Usually remove a large portion of the skin like that and put it back together. The advantage of the new technique is that compared to old techniques which causes people to die, usually 1 in 3,000 people die from the old tummy tuck, there are no deaths associated with the new technique. And the old technique, usually there's a pain for like a week, but with new technique patient can actually return to work in a day. And with the old technique usually you spend on the average about 12 days in the hospital. But with the new technique, as I mentioned before, you can go home right after surgery, and have seen people going shopping right after surgery. And with the old technique, about 10% of the patients require blood transfusions because there's so much blood loss, and also you have to put drains, which are little tubes hanging from the abdomen to collect the drainage from the surgical wound. We don't need drains or blood transfusions with the new technique. And old technique usually causes immobility of the patient, which leads to deep vein thrombosis, that's blood clots in the legs, which lead to pulmonary embolism, that is the blood clots can get dislodged from the legs and come and block the patient's big arteries in the lungs, which is a very serious complication. It can actually kill a patient. With new technique, patients are allowed to walk even in between during the surgery while she's having a break, and the patient is usually very ambulatory right after surgery, and some people can actually drive home themselves. There's no risk of pulmonary embolism at all. And what's a complete tummy tuck and what's a partial tummy tuck? Complete tummy tuck is when you remove the entire skin below the navel, below the belly button of the abdomen, and put it together. And also with the complete tummy tuck you have to reposition the navel or the belly button to a new position, and that is what we call a complete tummy tuck. Mini tummy tuck is where only the loose skin at the bottom of the abdomen is removed. Usually this is done when you don't have a lot of loose skin, but the patient likes to have a tight abdomen, so we remove a small portion of the skin what's required to make the skin tight, and then put it together. And we can usually put that incision at the very low, usually at the hairline of the patient. And with Asian skin, such as what you find in Sri Lanka, we have to be careful that patients may get keloids. Keloids are ugly scars which happen once you do repair incision. Once you put the skin together, that scar actually can grow and become an ugly scar. So we have to watch out for these things, especially with the new techniques. We don't get that very often, and if you get one of these, you can usually treat them with new techniques and make them go away. But still, we have to be aware of it. So we usually recommend tummy tucks for people who only really need it. And another reason is that now our liposuctions are so advanced that we can actually get a lot of tightness of the skin after a liposuction. Especially if the patient comes for a liposuction before they lose a lot of weight, you can do a liposuction and expect about 10 to 20% of skin tightness.